Welcome, everybody. We're going to be posing a couple of questions today. How is COVID vaccine distribution going globally? And are there any problems? And if so, what are the solutions? Hello, and welcome to the very first CEVA Talks. CEVA Talks is a series of live discussions with leading experts and practitioners from the logistics sector and beyond to share insights and best practices about different topics related to supply chain and logistics. CEVA Talks are featured in CEVA Logistics Insights magazine and their Thought Leadership e-magazine. Today's live talk, as you're well aware, is about resilient supply chains, safe, fast, equitable access to healthcare. And we've got two global experts giving their views today. Thank you both very much for being here. The COVID-19 pandemic, it's placed huge strains on the global healthcare sector. It's causing even greater inequities in access. The virus and its variants have been raging across the globe, stagnating immunization coverage in disadvantaged groups, particularly, often with poor infrastructure, over-centralization of medical products production capacity. These are just some of the facets of logistics complexity really impacting global healthcare at the moment. So how can we make pharma supply chains more resilient to improve equitable access to healthcare? What are the main challenges? What are some of the innovations that have been developed? How can pharma supply chain and logistics be improved? These are some of the questions our guest speakers are going to be answering. So again, welcome to everybody. And please don't hesitate to tap in your questions into the comments, and we'll really try and get to those as we go through this session. So who are the speakers? First of all, my name's Rob O'Byrne, and I'm the founder and CEO of Logistics Bureau Management Consultants, who operate globally. As well as running consulting companies, I've written 5 books on supply chain. I provide an online supply chain education program, and I host a YouTube channel called Supply Chain Secrets, which was recently ranked #1. By who? I'm not quite sure, but I've been working in supply chain and logistics globally for 45 years, so I live and breathe supply chain. Thank you, CEVA, for asking me to chair this session today. Now to our guest experts. Margi Van Gogh, Head of Supply Chain and Transport Industries at the World Economic Forum, a member of the Mobility Platform, which focuses on accelerating the global transition to safer, cleaner, and more inclusive transportation systems. They harness new technologies to ensure equitable access to mobility for society and sustainable delivery of goods to urban and rural communities. And Margi has an extensive background in healthcare and supply chain, as you'll see if you check out her LinkedIn profile. Prashant Yadav, a senior fellow at the Center for Global Development, affiliate professor at INSEAD, and a lecturer at Harvard Medical School. Prashant's a globally recognized scholar in the area of healthcare supply chains. He's an author of many peer-reviewed scientific publications. His work's been featured in prominent media such as The Economist, the Financial Times, Nature, the BBC, and I think even recently the New York Times. Prashant serves on the boards of companies, non-profits, and a venture fund. He's frequently asked for expert testimony on medical supply chains in prominent legislative bodies, including the US Congress. And Prashant has trained as a chemical engineer, and he obtained his PhD in management science and operations research. We are indeed in august company, so let's get right into the questions. Now, Margi, first question to you. World Economic Forum. Why is vaccine distribution of such interest to the World Economic Forum? What can the World Economic Forum actually do to help?
Gosh, thank you, CEVA Live, for hosting us in this sharing session, and to you, Rob, for the opportunity to address this important but very broad question. The forum's mission for 5 decades has been to improve the state of the world through private and public collaboration. And as the realization of a global pandemic that dawned in early 2020, with it also the reality that leaders from the private and public sectors, from academia and civil society, could achieve more and do so more impactfully by sharing knowledge and collaborating, even through cooperative competition, if you want to call it a co-opetition. As data insights and variants continue to emerge, we can all appreciate how profoundly true a quote from Henrietta Fore, the tireless leader of UNICEF, is. No one person is safe until everyone is safe. And a sustained global health and economic recovery really does require a cohesive response. The forum's COVID Action Platform and our CEO industry action groups have been stood up to facilitate just this, cohesive collective action. In the supply chain and transport industry, we are fostering dialogue with industry leaders, with the public sector, in a bid to identify common industry challenges and opportunities for collective action that improve and build resilience. The CEOs and senior executives from the leading transport and logistics companies, in conversation with public sector, academia, and labor champions, have considered some of the key business and supply chain continuity imperatives over this period. And I'll mention a few. The systemic importance of transport worker well-being and the need to resolve the ongoing crew change crisis. This is vital to keep goods moving safely whilst keeping people safe. This was tabled very early on in our conversations. The impact of constrained container and air cargo capacity, also in respect of inclusive vaccine distribution and better preparedness, was addressed well in advance of the first vaccines becoming available, and how we can build resilience through improved visibility, aggregating elements of private and public sector data for common good, and also considering how we can accelerate the transition to a zero-emission future are all topics on the agenda of our supply chain and transport industry CEOs. So the forum really helps to catalyze action with a desire to drive truly transformational systemic impact, no more so in the healthcare sector at the moment.
That was a really big question. So thanks, Margi, for encapsulating that. That's fantastic. Prashant, if we can come to you for a moment, we were talking the other day about this, and a key question I think for you is what key factors drive the economic geography of the healthcare and vaccine supply chains? And maybe we'll mute while you're speaking, Prashant. I think we're getting a little bit of feedback.
Thanks, Rob, and thanks to CEVA and to all the organizers to bringing us together to talk about this very important topic. I think it is important to recognize that the intense public scrutiny that supply chains have been receiving in the last 14 months is a two-edged sword in many ways. On one side, it is giving us the opportunity to highlight what our profession of supply chain and logistics does in truly impacting the lives of people, saving lives. On the other side, it is also exposing us to a number of public stakeholders who have relatively limited understanding of how supply chains are organized, what drives the economic geography of supply chains. So we often have political leaders who are now starting to talk about what I call a supply chain autarky, which is let's become self-sufficient, let's start manufacturing everything in our own country, and let's start having short supply chains. I think that is ignoring the fact that the reason the supply chains for health products, not just vaccines, but health products more generally, are organized in their current form has to do with three things. The first is, over time, clusters of know-how have evolved. And so if you look at the medtech industry, there are parts in Europe where electromechanical equipment is concentrated in terms of manufacturing because the know-how, the people, the talent for doing those activities concentrated there. Same thing with generic product manufacturing in India, or API manufacturing in China, or vaccine manufacturing in certain geographical hubs and so on. The second main reason is some naturally occurring substances, whether it is nitrile gloves, largely manufactured in Southeast Asia, or some key vaccine ingredients which still come from naturally occurring sources, such as some adjuvants which come from the bark of a tree in Chile and so on. So I think The economic geography is organized around core principles and has evolved to its current structure over a long period of time. It is not perfect. We have, as a result of the current economic geography, we have greater concentration of manufacturing in certain locations. We have to think very actively about how to create geographical diversification in the supply chain, including manufacturing vaccines and health products in new locations. But that shouldn't be on the basis of supply chain autarky and self-sufficiency as an idea. That should be on the basis of geographical diversification as an idea. And the two may have some overlap, but they are not the same things. And that's an important part for us to remember, but also for us as logistics professionals to educate and bring it out clearly to other constituents who influence policy and supply chain.
That's great. I appreciate that, Prashant. We've got some really interesting questions coming in from our audience land. Maybe you could drop those into the chat for us. People are asking about the blockage in the Suez Canal, for example. So, Margi, back to you. What are some of the broader healthcare supply chain issues that you're seeing emerge? I mean, is the problem around vaccine distribution really uncovering other issues for us? You're on mute there, Margi.
Oh, sorry, and I did do that. Recent reports suggest that the global economy is looking to be emerging from the worst of this pandemic, and growth trajectories are returning to levels last seen in 2019, particularly in the developed world. And whilst the recovery seems to be broad-based and across economic sectors, there are serious challenges that are standing out, and Prashant's perspectives are completely valid and visible. Developing clusters of excellence is absolutely imperative. The public health challenge in the developing world is deeply concerning, with an uneven struggle to control the pandemic. In China, the virus was contained last year. Beyond China, much progress is being made through widespread and effective vaccine distribution, particularly in the United States and the Eurozone. And the supply system seems to be functioning relatively well, in spite of Suez Canal, etc., Beirut last summer. However, in many emerging economies, vaccine supplies are inadequate. In Brazil and India, infection levels and mortality rates are crippling, and certainly to public health, if not always to economic growth. The United States, and we're seeing more than half the population receiving at least one dose. By contrast, in Brazil, that number is 33%, and in India, it's around 20%. In South Africa, where I come from, it's less than 1%. One objective of Gavi, co-leading the COVID response with COVAX and UNICEF, is to ensure global equitable access. This requires we rapidly accelerate development, that production and delivery of vaccines is achieved. We're probably on track with the former two. However, on the production and delivery side, we know that there are significant challenges, and finding solutions to these challenges, they're unprecedented in nature, they're unprecedented in scale, is really most effectively tackled collaboratively and through active partnership across societal value chains. In our sector, we've seen CEVA Logistics and CMA CGM amongst the first of leading global regional logistics players pledging support for the forum's COVAX UNICEF industry charter, this in support of inclusive vaccine distribution. Particular focus has been placed on how support that's needed and has been identified in planning distribution to and within low and middle income countries can be achieved. And this audience can well appreciate the magnitude of infrastructure and cold chain capacity challenges faced in some of these geographies. So strengthening capacity and prioritizing vaccine and peripherals as cargo is essential if we want to achieve a sustained global economic recovery. Cohesive efforts are rewarded with impactful outcomes, and I would certainly invite those with regional or global capacity and a desire to make a difference, to consider how we can all contribute to this charter and become a partner in accelerating inclusive vaccine distribution. Beyond the transport service, it's phenomenal to see how human resourcing that supply chain CEOs have committed materialize in organizations such as UNICEF, who are harnessing the private sector engagement. This is a unique approach to strengthening supply chain capacity and complementing public sector skill and experience with private sector capabilities and reach. It is a great demonstration of how public and private sector collaboration, together with academia, can serve vulnerable communities to inclusively tackle the local and global challenges we have on the ground.
I'm just going to go to a couple of questions here from our audience, because I really want to get to some of these. There's some interesting ones. From Iziomo, he's asking about how we can prepare ahead strategically for unforeseen events in our supply chains. There was, sorry, that's scrolled out of sight now. A gentleman in Singapore was saying, how do we cope with rising costs of sea freight and so on? Steve Wilcox is asking, what's your recommendation on the best approach for mitigating ocean freight rates for the next 12 months? I mean, this is getting down into the nitty gritty, but if either of you have some thoughts to share on that, how can we plan ahead? What's coming at us next? How can we mitigate these risks?
I'll start, and then Margi can add from the forum's perspective. I think for planning ahead, we need three things, in my opinion. The first is we need a more distributed manufacturing network. We cannot work with a model in which manufacturing remains highly concentrated, which means there are regions in the world which, either for vaccines or for other health technologies as well, currently do not have a regional production base. Africa, some parts of Latin America, some parts of Central Asia. We need to think about, and when I say think about, I mean in a sustainable manner, where can new production hubs come up and what does the global community need to do to make that happen? And that is not just a manufacturing problem, it is also a logistics problem, because for locating a new manufacturing plant for vaccines, you need to ensure that input supplies that need to come in and the exported output, both of those can function smooth and seamlessly, and that is not always easy around the world. So lots of things have to happen to make the logistics work. So that's the first part in preparedness: decentralized manufacturing, new production hubs. The second part is to rethink where to hold inventory in stockpiles and who should be responsible for doing that. We cannot run a model where we have national strategic stockpiles that are limited to a few countries. United States has a strategic national stockpile, which carries at least a basic amount of key medical countermeasures. Stockpiles also help smooth the demand. They help in finding better transportation options instead of trying to get everything in an expedited manner. One example would be trying to get syringes for vaccines, and doing air cargo for syringes is a highly expensive option. If we organize the syringe supply chain with the right kind of stock positioning and stockpiling locations, I think we can significantly reduce the logistics cost in the overall cost of vaccinating, not just the cost of the vaccine, but the ancillary supplies. So that's the second part, the role of inventory and how to better think about it. And third is on visibility of how stock and flow occurs in the supply chain. Where is inventory sitting and how is it flowing between different nodes in the supply chain? It's not a new idea. I think many of us have worked on this for decades now, but I think it's a sober reminder that we haven't still reached anywhere close to the kind of visibility that we need. The value of that visibility will be twofold. One is it'll allow individual companies, whether it's a manufacturer or a logistics company or a freight forwarder, to plan better. And when you plan better, you save costs, you are becoming more efficient. The second is that visibility will help in global coordination better, right? Countries have to come together The Economic Forum is providing a platform for such collaboration to happen. Companies have to come together, share their manufacturing capacity. But for collaboration to happen in a meaningful way, the foundational block is having the right information. Only then can you collaborate and coordinate. And that information will come from supply chain visibility. So I think those are three blocks that are crucial for us to start building for, to avoid something similar to what we are seeing with vaccine distribution inequity and other challenges now.
So from a broader supply chain perspective, I get that, Prashant. When we were talking the other day, you seem to be pushing for decentralization of vaccine production. So is that really critical at the moment, do you think?
Yeah, so I think if a region, the only thing we know at this point is the regions which had their own vaccine manufacturing capacity were ahead of everybody else in getting access to vaccine supplies. And I commend the efforts of COVAX and many countries in the OECD club who are donating their excess or surplus vaccine supplies. But the reality is that first access occurred to regions who had their own vaccine manufacturing. So it shouldn't necessarily become every country manufactures their own, but at least regions which don't have manufacturing, Africa being one example, we need manufacturing hubs there. What makes it workable and sustainable? There are many uncertainties. What kinds of vaccines will work in the future? Is the cost of decentralized production going to achieve price parity with the costs that come out of very large manufacturing sites in, let's say, India or other places? So I think one is, for decentralized production to happen, we as society have to accept something which I call as the resilience premium, which is pay a slight premium on the cost of purchasing a vaccine, because that is helping you build resilience for the future. Whether it's 10% or 15% or 20%, I don't know the answer, but we can work the analytics out. The second part in this is flexibility, which means if we set up a new manufacturing site in Africa or in Latin America, we have to make sure that it is ready for the future. And for it to be ready for the future, the only thing we know is there is uncertainty about which vaccine platform will be our best bet for future pandemics, whether it will be mRNA, whether it will be viral vector, whether it will be protein subunit, or the more standard inactivated viruses. So if the manufacturing capacity has flexibility built into it, and there are barriers of physics and chemistry that will come in the way, which means we can't have a plant which can make every single platform. But to the extent that we can build flexibility in, even if that flexibility comes with a higher capital expenditure and a slightly higher operating expenditure, I think that's an investment that is very worthy of making. It'll protect us against the uncertainty of which vaccine will work better against variants for COVID-19 and which vaccine platform will work better for any future pathogens. So I think those are the ideas that need to be built into the common narrative of, yes, let's have distributed manufacturing. I think as logistics and supply chain professionals, we have to build these core operational components underneath the larger political idea that, yes, let's have more decentralized manufacturing.
Okay, that's great. Now, Margi, you've been sitting there listening to this, your opportunity. I would be intrigued to hear what your thoughts are around this whole issue of, is the COVID pandemic actually providing impetus to improve healthcare supply chains generally? Because, your focus is equitable access to healthcare. So is COVID going to be positive in that sense? Is it really going to make us, change our systems and have better provision?
Rob, whilst listening to Prashant, my thinking was around really how this is indeed a once-in-a-lifetime opportunity. There is a compelling need and there is an obligation to serve with purpose, to center our mindset, to Prashant's points on yes and how, rather than no and why, we can achieve distributed manufacturing hubs or multimodal planning. And certainly visibility is a prerequisite for meaningful, equitable solutions to be created. As a result of this global health crisis, vulnerable communities around the world have become more vulnerable. The humanitarian sector and the draw on them is far greater And as the global community lives through this unfolding crisis, we really need to reflect on the lessons that we can apply going forward. Well-intentioned responses, coupled with the prevailing opacity in the global supply system, has led to multiple disruptions across the supply ecosystem. And the consequential social and economic impacts that have rocked and continue to disrupt sectors and multiple sectors is not going to be solved easily without visibility. We can think about the aviation sector, the hospitality sector, tourism, agri-foods, and yes, of course, healthcare. Lives and livelihoods are being exposed daily as business, government, and the humanitarian sector is grappling with continuing, capacity challenges and continuity challenges. We've mentioned a couple of continuity challenges, perhaps a little bit unforeseen, right? Such as Suez and what the impact of that has been. The disruption within the transport sector is prevailing to varying degrees. And both the private and public sector stakeholders are likely to continue to struggle, particularly with pharma and healthcare supply chain issues for the remainder of this year, if not next, as COVID outbreaks surge in different regions worldwide, most markedly in the global south. So vulnerable communities reliant on the movement of essential goods such as food for nutrition, medical supplies, are facing increasing socioeconomic risk, and the crisis is deepening in many of these locations. The need for collaboration to address these supply chain challenges has never ever been more obvious or more pressing. And I think to Prashant's point, supply system resilience really needs to be improved. If agility is the key to resilience, then improved visibility is vital for such agility. And within the supply chain and transport industries, with the Consumer Industry Action Group, we've been considering how we can better harness data and existing technology platforms. With academia and the public sector championing this, we're exploring the development of an open source visibility tool, aggregating least granular levels of anonymized transport sector, commodity sector, and disruption data to deliver system-wide visibility that can enable and prompt even preemptive action. Think about the Johns Hopkins dashboard and what's that meant when we use it from different lenses. Bringing ecosystem stakeholders together to inform the development of such a conceptual meta layer of visibility solutions provides a really unique opportunity to build transformational systemic resilience for healthcare, for the humanitarian value chain, and for sustainability. And that will lead to multiple benefits, multiple use cases, but most important to enabling us in the supply chain and logistics sector to work with partners across the value chain to protect lives and livelihoods through achieving better transit times in the event of a disruption.
No, thanks for that, Margi. Now, I've just got a sort of supplementary question there for you. But just for our audience, do feel free to type in some questions. I'm watching the time. We'll have time for answer a couple of your questions. Please don't make them too long because I have to scribble them down quickly as they go across the screen. Margi, we were talking the other day about some sort of knock-on effects, particularly in the maritime sector. Maybe just share with us some of the things that you're seeing, some of the insights there about how that sector is being disrupted.
Yeah, this is just phenomenal when one thinks about how the outcome could have been different. So in the maritime sector, I think everybody is well aware that 90% of all products moving around the world is moving by ocean. The ocean community is served by people. The well-being of our seafarers is absolutely paramount to continued supply system effectiveness, and that is imperative for economic return to growth and stability. We have 1.4 million seafarers approximately around the world serving us, bringing food to our tables. Those 1.4 million seafarers are today, unfortunately, not being seen as essential workers. They are not granted essential worker status by the vast majority of global governments. As a result of that, the impossibility for them to change in ports around the world, take rest time, be replaced with other crew who can continue safely to operate the vessels that carry our goods, is just incredible. And this is one of the major concerns that we have, is how do we ensure that there is a recognition of well-being and safety of the people who are carrying and supporting global economic business continuity.
I think that's a great perspective. And, you know, to a degree, the spotlight has been on supply chain generally over the last 18 months or so. But I think the maritime sector and the seafarers have certainly been forgotten in that. And very, very good points. Thank you for that, Margi. Prashant, maybe just come back to you with another question around mass vaccination sites. We talked a little bit about the decentralization of production. What role do you think mass vaccination sites have, and what's the impact of that on our supply chains?
Yes, I mean, everywhere around the world, the challenges have been of two types. The first is, how do you get access to vaccine doses quickly? And once you have them, how do you vaccinate your population as quickly as possible? So the first part has to do with how do you purchase, how do you create equitable purchasing structure, COVAX, more manufacturing. Then once you have vaccines, how do you make sure that those doses go into arms of potential vaccinees as quickly as possible? The two strategies are, one is to rely on existing healthcare infrastructure, which is clinics, hospitals, pharmacies. And that has benefits, which means people go to a trusted provider, people go to a site which they visit for routine healthcare. But it may not be able to do, no large hospital can do more than, let's say, 1,000 vaccinations a day. So if we want to get to 5,000 a day in a single site, we then have to think about stadiums, sports arenas, and other kind of community locations. So in addition to being able to vaccinate a lot of people quickly, it also brings a logistical benefit, which is on one side, you're pooling the demand, and on the other side, you're pooling the supply. The drop-off is of 5,000 vials and not of 50 vials to every drop-off point in the supply chain. So you have efficiency, you also have shorter lead times, better ways of planning cold chain and so on. So those are the visible benefits, and that's what has led to many countries creating mass vaccination sites. Again, they are short-lived, which means after 5-6 months, you have to shut them down. And we are seeing that happen in the United States. The stadiums which were COVID vaccination sites are now back to becoming athletic stadiums again, and we are having football games and so on. But the other important part in mass vaccination sites, which gets forgotten, is it is an incredible opportunity for new partnerships to emerge. So if you think about a large hospital in, let's say, a big academic medical center having multiple hospitals, if you go there and say, look, I'm going to bring in a new set of partners to help you think about queue management, to help you think about how will the logistics of potential vaccinees coming in, going out will be worked out. They will say, we do this for a living. We run this hospital. We don't need a private company. We don't need a Starbucks. We don't need a Carrefour. We don't need a CEVA to come and help us with this. We know this business. But when you create it in a new stadium, you're starting with a clean slate. You can draw the blueprint of the partnership in the best possible manner. You can say, who is the company or the partner who is best at doing queue management? Who is the company or the partner who is best at inbound logistics? And then you can assemble that partnership in a unique way that can help not only for running the mass vaccination site, it also creates better opportunities for future preparedness collaboration, which means the queuing guy and the inbound logistics person are now connected on phone, WhatsApp, other means, so that next time they will themselves figure out ways to collaborate. So that's where I see the immense collaborative opportunity and benefit from mass vaccination sites. I think the collaboration platform that the Economic Forum runs works exceptional for global collaboration. But I think we need to think about at the national, subnational, district, city level, how do we have a blueprint in which a private company and the local government can come together? And it should not be very cumbersome on either the government or the private company to say, here is what I can offer, here is what we need. Can that be a part of a more established blueprint? And that's what I think the mass vaccination sites can be one step towards, but we need to do more to create the equivalent of the pandemic supply chain network platform at each sort of country, district, subnational, provincial, and city level.
No, I think that's a great insight, Prashant. And as you were saying that, I was thinking back to the early days of the pandemic, and I'm based in Australia, and competition or collaboration between major competitors in the market was illegal. That was wiped aside early in the pandemic, so that retail competitors, production competitors could actually collaborate on getting product to market. And maybe this would be one of the good things to come out of this, that we'll see that product availability, particularly in healthcare, can be made so much more efficient if people just collaborate. And I think, to your point, the mass vaccination sites, I mean, that's a supply chain dream. Everyone's coming together. It makes the whole supply chain so much easier. We had an interesting question come here from, I hope I pronounced your name correctly, Haitam. And it was all around the increase in shipping costs and so on. I might have a go at that one, and Margi and Prashant, feel free to jump in with another perspective. But I think what we're seeing with this huge hike in shipping costs and lack of availability of space, it really comes down to one simple thing, and that's over the last 18 months, our demand, our supply has been so disrupted that natural balance of product movement around the world, which maintains, it's all in equilibrium, and we've got full containers going one way and then full containers coming back the other way. All of that was knocked aside. And we've ended up with ships in the wrong place, containers in the wrong place, no product to put in the empty containers to come back. And all of that has just caused the whole shipping industry, cost to spike. But that would be my simple answer. I'm not sure if you wanted to add to that.
One thing I'll add, Rob, is that an interesting economic shift in our spending patterns is worth examining in greater detail. So I think our spending on services, right? We don't go to restaurants as often. We don't go to the cinema much. We don't spend on services as much as we used to in the pre-COVID period. And we've replaced the services spending by acquiring more goods. All households around the world are buying more goods because they have some
renovating our homes.
Yeah. And that means more goods have to move through the supply chain. And because more goods have to move through the supply chain, and if those goods are of the nature that they are manufactured in a faraway location in Asia, then yes, the Asia to Europe, Asia to North America, Asia to Africa, those trade routes will remain very strained till the time the consumption patterns go back to services spending. When the economy opens up, people start going back to restaurants and their other service things. That's when goods consumption may fall back. Until that time, I mean, I don't see any way out of a very strained logistics sector, not just for ocean, but also for trucking capacity.
No, that's a great insight. Now, I'm going to pose one final question, and I'll give you a minute or so each to answer. Maybe, Margi, I can start with you. What is the number one thing that needs to be done right now to improve vaccine distribution, particularly to poorer and more vulnerable parts of the world?
One thing, there are so many, but the one thing is probably, if we use the example of UNICEF harnessing private sector resource and capacities, to Prashant's point, this unique approach to strengthening supply chain capacity and complementing public sector skill and experience on the ground is really a great demonstration of how public and private sector collaboration can serve vulnerable communities to inclusively tackle the global and local challenges that we face on the ground. Future preparedness and resilience through leveraging shared data insights, harnessing supply chain and logistics networks and skilled people really is going to be central to the success of this effort. What we measure, we can manage and we can improve. I certainly do not think I'm alone in feeling that we have a deep sense of obligation to actively seek out and serve with leaders of this generation who are prepared to use the offices we hold to empower visionary, courageous, and a transformational inclusive action. This is going to serve developed markets and developing economies, particularly those focused on co-creating in the interests of vulnerable communities and future generations, be that through accelerating the adoption of sustainable zero-emission transport, or be that through the distribution of equitable vaccines to secure a global economic recovery. So I believe that collaboration, that yes and how versus no and why mindset is primary in the leaders and CEOs and academic brains today.
Okay, fantastic. Prashant, 1 minute, same question. Do you remember it?
Yes. So I think the one most important thing to reduce inequity in vaccine coverage today is about increasing manufacturing supply. I think it is important to have other things such as logistics, operational infrastructure, but at this point, we need more manufactured supply. In the very short term, the doses can come from many countries who have existing contracts and have surplus doses, reallocating those doses to go to countries which don't have, either through COVAX or whatever arrangement they find. And then it'll be the logistics need to quickly move those doses to the countries where they're getting reallocated as quickly as possible, but without necessarily becoming too much of a burden on the logistics cost. In the medium term, it'll have to be more manufacturing capacity. I think so. Those are my key asks for what is needed.
Great, thank you for that. We've got some really interesting comments and questions coming in. Keep those coming on the comments because we can all jump on to LinkedIn later and provide some feedback on those as well. So at this point, we have about 2 minutes left. So I have to just start drawing things to a close. But the session replay will be available on CEVA's LinkedIn page. So I know there are some people who couldn't join us today. You might also want to follow CEVA Insights content on the major social media platforms. You'll see lots of updates and news and articles there. And also look out for details for the next CEVA Talks session, which I think is coming up in September. So lastly, from your host, Rob O'Byrne, my thanks to CEVA for this initiative and to our two fantastic guest speakers, Margi and Prashant. Thank you so much for joining us and sharing your knowledge and insights. I know you're both very busy people. But lastly, the biggest thank you to our audience today. Thank you all for joining us over the last 45 minutes or so, for your feedback, for your comments. I look forward to seeing some of that after this session. And don't forget to connect with all of us here on LinkedIn and on other major social media platforms. So thank you all for joining us, and maybe we'll see you next time.
Thank you, Rob.
Thank you. Thank you, Rob.